For more than 2 decades, the Georgia Health Policy Center, GHPC, at Georgia State University, has taken on the nation's complex challenges in health and healthcare. We provide research, program development, and policy guidance to local, state, and national stakeholders, both domestically and internationally, to advance health and well-being. Let's look back to our beginning. The Policy Center was founded as the research arm of the Georgia Coalition for Health, a group of consumers, providers, businesses, and government advising the state on health reform efforts. Dr. Jim Ledbetter served as the first director. At the request of the governor, the center studied Medicaid reform and delivered directions for change to the legislature. GHPC joins the Andrew Young School of Policy Studies. Young's values and beliefs continue to influence our vision. The center helped design and continues to evaluate Peach Care for Kids, the state's children's health insurance program. GHPC is the administrative home for several organizations, including the Philanthropic Collaborative for a Healthy Georgia. These foundations have supported school and rural health, safety net, and youth fitness. This establishes a new core competency. Dr. Karen Minyard becomes director. The center applies insights gained from Georgia to rural communities across the nation. Partnering with the Health Resources and Services Administration, the Community Health Systems Development Team has provided technical assistance to more than 1,000 communities in 50 states. The center begins work with public health agencies on rural health, asthma, cancer, obesity, and tobacco. As a founding member of the GHPC, Georgia Health Decisions promotes involvement of citizens in decisions about health care. The center convenes more than 800 participants at the Summit for a Healthy Georgia to identify health priorities for the state. GHPC first works with the CDC along with the NNPHI to expand the health transformation conversation to include population health. A report is released to bridge public health and health care, and language from that report is later included in the Affordable Care Act. GHPC begins the Legislative Health Policy Certificate Program for Georgia lawmakers. It is designed to help officials make more informed health policy decisions. Long-term services and supports grows efforts to improve the lives of the aging, elderly, and disabled in their transition from institutions to community settings. The Georgia Student Health and Physical Education SHAPE Act was passed to assess children's fitness levels. GHPC becomes the home for Communities Joined in Action, a national organization of 200 health collaboratives. The landmark Affordable Care Act passes. Taking a national leadership role, the center translates the law and broadly disseminates materials. The center creates the Sustainability Framework, a nationally adopted tool. This marks a time of great growth at GHPC with the following national centers and initiatives: the Atlanta Regional Collaborative for Health Improvement, the Leading Through Health System Change Planning Tool, the Center of Excellence for Children's Behavioral Health, the Robert Wood Johnson Foundation's National Coordinating Center for Bridging for Health, a Patient-Centered Outcomes Research Institute's Program Office. And the growth doesn't stop there. GHPC applies health impact assessments to housing policy and gains national attention. Building on stakeholders' interest in collective impact as a model of change, the center provides technical assistance, evaluation, and backbone support to partners implementing projects nationwide. In 2017, health reform is once again in the spotlight. The Policy Center rapidly translates proposals. Substance use disorder becomes a widespread epidemic, and the center responds with research, strategic planning, and systems thinking skills. Rural health is also on the forefront of the health policy landscape. Using the center's deep experience, GHPC develops Understanding the Rural Landscape, a training module. The center expands to have an international presence focusing on population and global health. The GHPC has grown from a local policy advisor to a national thought leader, now working across the world. Our collective knowledge base continues to broaden with each project undertaken and community served. These experiences serve us well as we expand services, partnerships, and overall impact on health.